My name is Rainer Halenke. I'm the owner here of the cattle and hunting ranch Schornau. We are about 50 kilometers from capital of Windhoek. It takes about 50 minutes to drive out here. At the moment I have 4 houses occupied, so it's around about 15 to 20 people.
Farm Access Foundation is a Dutch nonprofit working to improve access to quality healthcare services by strengthening the private health sector across Africa. In 2010, Farm Access Namibia launched the Mr. Sister Mobile Health Service, an innovative program created to provide primary healthcare to employees and their families living in rural and remote areas of Namibia. More than half of all Namibians live in rural areas, making physical access to a healthcare provider a real challenge.
Namibia is the second lowest densely populated country in the world. We have a population of about 2 million people, and it comes down to about 2 people per square kilometer. The agricultural sector is one of the largest employers in the country. Just in the commercial agricultural sector, we have about 40,000 employees. And then it must be remembered that the families of these employees also live on these farms, which makes it quite a large household. The commercial farms are spread over the country, so the vast distances means that the employees on these farms are very far away from clinics and other healthcare facilities. Your transport opportunities have to be coordinated with the employer of the farm when he is conducting businesses in town. So transport for these employees are a problem.
In the past, the employees came to me and informed me about either themselves or a family member who is sick. Sometimes I could help them by my own medication, but I only use it for minor problems that they had, painkillers for instance. Otherwise I took them to town. That was obviously not possible always on the same day. Sometimes it took a day or 2 before I could take them to town, but then I drove them direct to the hospital.
What began as a pilot program in 2009 has grown into a full-fledged rural health service, delivering primary health care to over 1,000 patients per month.
I decided to join firstly to see if it really helps me out, that I can cut down on tours to town to bring sick people to the clinics or hospitals. And I found out that later the people really didn't come and ask me for either medication or for a drive to town. So I really also cut down on my fuel costs as well. To be honest, I really have the feeling that the health of my employees also increased, because they also sometimes said, okay, I don't want to go to a hospital or clinic because I wait there the whole day. I don't see a doctor that day, maybe even next day only. They also sometimes had no shelter in town where they could go, or family members where they could live, so it was difficult for them as well. So it is much easier for my employees to get medication or seeing at least a nurse to get a little bit help on their health issues.
My name is Christoph. Dit was baie uitgawe om by die kliniek uit te kom. Ek voel dis 'n goeie ding. Dis baie goeie ding. Want ek haal nie baie uit die wat ons uithaal is tog baie nie. Ons haal net R5 uit en die plus die res betaal die plus. So ek verdien is baie goed. Hulle is baie goed met die mense. Hulle praat altyd met die mense. Hulle vra vir jou waar is die wat is siekte het jy, waar is jy seer? En as jy vir hulle sê as hulle nie medisyne hier het nie, dan skryf hulle vir jou weer dat jy miskien by die dokter uitkom, dat die dokter kyk vir jou. En vir my vrou en my kinders, hulle word ook hier gehelp deur my naam.
Despite Namibia's reclassification by the World Bank as an upper middle income country, nearly 1/3 of all Namibians still live at or below the poverty line, which is about 12 Namibian dollars, or just over $1 per day.
My name is Zam Farid Shawal. I'm the Chief Medical Officer for this region, Commerce region, which is the region where the city of Windhoek, the capital city of Namibia, is situated. Namibia has been classified as an upper middle class income country. However, the disparity in incomes is quite huge in the population. There are very poor people in Namibia who are disadvantaged as far as health services is concerned, because from historical perspective, the health services were basically concentrated in the cities and big towns. The villagers and the poor communities are sort of disadvantaged, and this is why the ministry is currently busy trying to make health services more accessible to the communities.
Mr. Sister uses a unique mixed funding model to leverage both public and private sector resources in covering the cost of delivering these services. The Ministry of Health, which would otherwise provide treatment to the same patients at the nearest health center, supplies the necessary drugs and vaccines used by the clinic. Commercial farms and other local businesses are contracted and pay a monthly fee to cover some of the costs of bringing health care to their employees.
I'm Annie Bartley. I'm the HR manager for Bokomo, Namibia. We are a company that's 50% owned by South Africa Pioneer, where we get a lot of products from, and then the other 50% is a Namibian-based business. Since we've introduced the clinic on the premises, all the ladies can get their contraception, everybody can get whatever they need from the clinic, and then obviously what is very good is like preventative health. You can pick up all these things like diabetes and high blood pressure, and you can prevent serious illnesses, and I think the big benefit is in that you can pick it up. And on the other hand, you've got a much healthier workforce. People are getting attended to on a bi-weekly basis.
Donor funding and corporate social responsibility contributions help fill the gaps in funding. This model then allows Mr. Sister to deliver the same services to communities along the clinic routes that would otherwise not be able to afford them. For example, funding from Namibia Medical Care, a local private medical aid fund, is cross-subsidized into providing services to poor communities and nonprofits that look after orphans and vulnerable children.
My name is Ilanza Kutsia, and I'm the country manager for Orange Babies in Namibia. Orange Babies is part of a Dutch NGO, and the main aim of Orange Babies is basically to provide care for HIV positive pregnant mothers and also children. Rebecca. The center in Okahanya is basically the one that is very much involved with Ileni Tulukwafeni, a community center. We have a nutrition program with them where we feed about 400 children. So once a day we provide lunch to them. We became involved with the Mr. Sister Clinic at the beginning of 2012, where the Mr. Sister Clinic goes out once a month to provide primary health care to the 400 children, which is part of the feeding scheme at Ileni. We also have about 20 community mothers who take care of these children, and we use the community mothers to communicate vital information to the parents and the guardians, informing them when the clinic will be and also what documents they should bring, and to make sure that the parents and guardians do accompany the children who needs to see the clinic.
The results of a 6-month study among children at Ileni and other clinic sites that serve orphaned and vulnerable children showed improvements in immunization coverage and reductions in both parasitic infections and cases of childhood anemia.
When a child has been sick or is sick at school, the teachers don't normally take the children to go and see doctors or nurses or even to the hospital. The child would just be sent home, and then it is up to the parents. The parents have to take responsibility to take the children to the hospital, and because some of the parents are working, they only get to do that after hours, and they don't have money to pay emergency fees at hospitals. So this has made it so much easier for them to come to the Eleni Community Centre and be seen to either on the first day that the mobile clinic is there or on the second day.
In 2012, Mr. Sister began servicing poor communities living in the informal settlements around Windhoek.
My name is Patricia Sola. I'm the program manager of Hope Initiatives, Namibia, and I'm also the founder. In Windhoek, the informal settlements are situated on the outskirts of the city of Windhoek, between 15 to 18 kilometers out of the CBD area of Windhoek. You find that 70% of the population in informal settlements live below the poverty datum line. 30%, the other 30 are informal traders in trying to care for families. This is where you find the bulk of single mothers. You find, according to latest information in terms of a research that has been carried out, informal settlements are also the area where you have the highest rate of HIV infection rates in Namibia. I forgot to mention, I think importantly, that it's also the area which has the least governmental intervention. In terms of schools, in terms of basic provision, in terms of amenities, it is the place that has the least in terms of the provision of these services.
My name is Sarita Sehgal, and I work as a partnership advisor for UNAIDS in Namibia. Windhoek is quite well serviced compared to rural areas where people have to travel for long durations and distances to get to services, to clinics. However, the inhabitants of informal settlements, especially those that are in the most informal areas that have recently been established, they really do have to travel long distances also to get to the clinics. And not only do they have to travel, but they also don't have funding to take a taxi or whatever, so they end up usually walking. And obviously, if you're not feeling well, it's very difficult to walk for miles to get to a clinic.
My name is Elizabeth. I used to stay in Leeds. I've lived here for 2 years. I used to work here 25 kilometers to go there to Windhoek. Used to pay 15 there, the taxi. If you don't have money, you don't used to go there.
We sort of brainstormed and thought, well, it would actually be really good if these clinics could also go to the informal settlements because currently they're underserved. So it was kind of a novel idea, and Farm Access went about liaising with the Ministry of Health, and the Ministry of Health was very keen on it and was receptive. So they actually then started going out to the informal settlements, and they've seen that the inhabitants are really excited because it's much easier for them to get their services. What's also nice is that they've partnered now, or they've found areas to set up their clinics, which are areas where community-based organizations are running. So that means that the community-based organization not only has its own services, but it's also linking up with other services. And it's a nice way of bringing the community together and strengthening community mobilization and access to health.
My name is Martin David, councillor for Moses Karweb constituency here in Commerce region. The services that we are receiving now from Farm Access is welcomed by us because there is no way someone gets sick and they must take transport, go and beg. You talk about $20. And so now the people are happy because walking a distance to come to the clinic, paying $5, you walk again back home. So it's, services that is acceptable. And the people in the surrounding areas, they feel comfortable, they feel happy. Even now, they used to see the clinic standing here without inviting them even from their houses. They can see the clinic when it is parked here. So one will just pick the papers and they quickly run to come and have treatment by the mobile clinic.
Mr. Sister's mixed funding model allows public money to go further in reaching rural and medically underserved communities. As a non-governmental organization, Mr. Sister has greater flexibility in scheduling staff, maintaining vehicles, and expanding coverage to meet the growing demands for healthcare services. People who would otherwise travel to a government clinic now access care closer to home. Employers save on transport and other medical costs, and those who have the least are not left behind.
On behalf of the Office of the President and the Office of the First Lady of the Republic of Namibia, we are delighted to support Miss Sister Mobile Health Services. My life as a nurse during the liberation struggle and after independence has been dedicated to improving access to health services and care for fellow women, children, and men. We are so pleased that the government has played an integral part in this innovative initiative private-public partnership in the provision of health services, and we look forward to its continued success and expansion for the benefit of our people. Keep up the good work.